I am so sorry. I've literally just ran in from the hospital.
No worries.
Hey, do you know what this reminds me of?
Dinner?
No, a Colles fracture, like the dinner fork deformity.
I don't know what that is.
Well...
Colles fracture occurs when a person falls on an outstretched hand, commonly known as fouche. This results in a fracture of the distal part of the radius called the metaphysis. This fall causes the broken fragments of the radius to tilt upwards. A Colles fracture could be sustained from both low and high impact traumas. However, those with a history of osteoporosis are at a much higher risk of sustaining a Colles fracture due to lower bone density.
Once it is suspected that someone has a Colles fracture, different anatomical modalities are explored to clearly see the bones and the suspected fracture. The best modality for identifying a Colles fracture is plain radiography. X-rays of the wrist allows a practitioner to clearly see the distal radius and ulna, along with the carpal bones and the radio-ulnar joint. A Colles fracture is diagnosed by identifying a fracture of the distal radius, seen in an anteroposterior projection. The Colles fracture is also classified by observing a dorsal angulation of the distal radius, seen in a lateral X-ray.
This modality is quick and highly accessible, which is important since the Colles fracture is the most common distal radial fracture. Because the radius and ulna are high-density structures, bone, they absorb a high percentage of the X-ray beam and have a radiopaque appearance. The visual contrast between high-density bone and semi-radiopaque tissues provides clear visualization of bone fractures without the need of more complicating imaging such as CT scans. In a Colles fracture, a lateral view highlights the posterior displacement of the distal radius, resembling the shape of a dinner fork.
Oh yeah, that makes sense, but how do you know it's not something else?
Well...
When diagnosing a Colles fracture, it is important to note the direction of the displacement of the distal radius fracture, as it has a similar appearance to a Smith's fracture. A Colles fracture occurs when the patient has fallen on their hand in an extended position, causing the displacement of the fracture to be in a dorsal direction, whereas a Smith's fracture occurs when the hand is in a flexed position, causing displacement to be in a ventral or volar direction. This further highlights the importance of taking multiple plane radiographs in different planes of view. This is so the Colles fracture is properly diagnosed due to the plane radiograph's disadvantage of superimposition. In an anterior-posterior view of the forearm, there is superimposition of the fracture. It makes it hard to determine the difference between the epithelial line and the fracture itself. It's not until a lateral view that the fracture is now clearly identified.
Bone heals through 4 complex processes. These involve hematoma formation, which occurs shortly after the injury and involves recruiting a number of inflammatory and stem cells to begin the healing process, soft callus formation, which involves the formation of a cartilaginous tissue around the injured area. At this stage, angiogenesis has also occurred to nourish the developing bone. The formation of the soft callus allows some stability of the injured area, however, this is not enough. Therefore, the third step in the healing process involves the formation of the hard callus. At this stage, bone replaces cartilage through calcification. However, the new bone is in the form of woven bone. Therefore, to further stabilize the area, woven bone is then replaced with trabecular bone through bone remodeling. For a bone to heal completely, it can take as long as 12 months.
And now you know.
Well, a Colles fracture is.